This is the hospital where Dave Blewett will undergo an angiogram to determine if he needs further treatment. If there is indeed a serious blockage in one or more of his arteries, then Dr. Ibrahim may decide to perform an immediate intervention.
All cardiac catheterization procedures, including angiograms and the implantation of drug-eluting stents, take place in a special section of the hospital called a cardiac catheterization laboratory. Dr. Ibrahim will perform the procedure.
So he sent him for the angiogram to see if he has blockages or not, and we'll see what we can do about it. Yeah, I think we see where the problem is.
After examining the pictures from the angiogram, Dr. Ibrahim discovered that one of Dave's major arteries was severely blocked.
It's significantly narrowed. The blockage is about 90% or more.
Wow.
Here's a blockage, if you can see, right here. Okay, you may feel some chest discomfort when we inflate the balloon.
Prior to deploying a stent, the vessel must first be expanded with a balloon.
This is a balloon here on the wire. 6.
6.
Okay.
So put a stent in there? Or?
Yes, hopefully we'll put the stent in there.
Okay.
3516, Texas. On the wire.
In Dave's particular case, Dr. Ibrahim decided to go with a drug-eluting stent developed by Boston Scientific, called the Taxus Express 2 paclitaxel-eluting coronary stent system.
When I was diagnosed with multiple myeloma, I was 37, in the height of my career in the pharmaceutical industry, in a wonderful marriage, and the mother of a beautiful one-year-old little girl. So when I found out that I had this incurable cancer, it turned my entire life and my entire family's life upside down.
Have you ever heard of multiple myeloma? Well, many people haven't. Not until one of their family members or they themselves have had to face this type of cancer.
I think the greatest motivation for me is my children. I would never want my children to look back and think that their mom didn't fight as hard as she could to be there for them. So every single day when I wake up and I have a full day, I think to myself, it's okay, because the whole point of this is for me to be there to raise them as long as I possibly can.
Funding and awareness efforts from organizations like the Multiple Myeloma Research Foundation are helping to pioneer better treatments and breakthrough therapies for this cancer. In partnerships with government and private industry, they are actively searching out the research that deserves additional grants in order to develop new treatment options and perhaps a cure.
Well, the Multiple Myeloma Research Foundation is a foundation that really helps spur the research interests in myeloma, and it does so in at least two different fronts. One is to actually fund a lot of the beginning research. The other avenue that they really foster the research community in myeloma is they sponsor what are known as roundtable discussions, where several times a year they will bring together the leaders in the field for very intimate discussions and exchange of research ideas.
Recently, high-quality, high-value research grants have begun to pay off.
The first exciting area in myeloma, which is already making a difference for patients, involves novel drugs which target not only the myeloma cell, but also the marrow microenvironment in which the myeloma cell lives. An example of those class of drugs would be thalidomide.
A few years ago, Dr. Barloghi's group at Arkansas showed that thalidomide works in about 25–30% of patients with advanced myeloma.
We treated about 100 patients with a systematic evaluation of thalidomide, and we reported in the first 80 or so patients in the New England Journal a response rate of 30%, including some who actually achieved complete remission.
Thalidomide, an oral agent, in combination with dexamethasone, another oral agent. Both of these drugs are not traditional chemotherapy drugs, and that has had very good success, and we are still testing it.
there are many other drugs coming along, all of which have in common that they kill the tumor, sure enough, but they also act in the microenvironment for therapeutic advantage.
Some modified thalidomide drugs, IMiDs, were designed with the intention to have greater anti-tumor activity and have less toxicity.
The second class of drugs that's very exciting and we hope will contribute to the eventual cure of myeloma are those drugs that are going to be designed to specifically inhibit the growth circuits inside of myeloma cells that allow them to grow uncontrollably. Or on the other hand, novel drugs that are under development that will this time turn on the death circuit inside of myeloma cells, which for some reason is not in functioning as it does in normal cells.
Looking at her now, it's tough to imagine Jessica Hicks is healing from a fractured neck. Her ordeal began the night of her senior prom. As she drove home alone in the rain, she lost control of her car and hit a tree.
I was driving on a really dark, curvy road. The roads were wet because it had been raining all day. And that is all I remember of the actual driving part. I remember waking up in the hospital to, "You are very lucky to be alive."
When Jessica arrived in the ER, she had a head injury and fluid in her lungs from vomiting while unconscious. X-rays showed she had also fractured her top 2 cervical vertebrae. That is, the part of the spinal column that holds up the head.
The X-rays indicated a very complex injury. She had a dislocation at C2-3 with a disruption of the disc. She had a hangman's fracture of the second vertebra, and then she also had a bilateral fracture of the ring of the first vertebra.
But before putting her through spinal surgery, Jessica's doctors felt she needed time to recover from her head injury and lung infection. During this recovery, she wore a halo vest at all times to keep her head and neck steady.
45 extra pounds on your upper body is no kind of fun. Getting up hurts, moving hurts, breathing hurts.
As she was recovering, we were making plans for permanent stabilization, and we chose to use the new Blackstone Medical Ascent system, which is a modular system that allows us to connect the spine to the skull with a modular system of various screws and rods and plates, the latter that attaches to the back of the skull.
I understand that you've been diagnosed with lung cancer, is that correct?
Right. We went down to the hospital and had a CAT scan done, and it showed a mass in my lung that was kind of hid behind the shadow of my heart.
According to the American Cancer Society, in the United States there are over 12,000 new cases of esophageal cancer and over 164,000 new cases of lung cancer each year.
The battle against cancer has inspired some innovative therapies that have brought greater hope and improved survival rates. Recently, people with esophageal or endobronchial non-small cell lung cancer have been given new treatment options that may improve their quality of life.
One of the real problems with malignancy or cancer of the lung, as well as cancer of the esophagus, is by the time most patients present to the doctor, it's too late to be cured. The tumors have spread to areas where surgery is really not going to cure them. For those reasons, we worry about palliating the patients, try to improve their quality of life, since no matter what we give them, radiation, chemotherapy, surgery, we really can't extend their quantity of life.
The opportunity for treatment of these tumors comes in the form of a laser light, which is used to trigger medication. The treatment is called photodynamic therapy, or PDT, and it's performed as a standard endoscopic or bronchoscopic procedure. And in many cases, the patient doesn't need to be put under general anesthesia.
Well, the majority of patients who present with lung cancer present at stage 4, and they're already experiencing problems with shortness of breath or coughing up of blood that we call hemoptysis. Photodynamic therapy allows us to help palliate both of those symptoms.
The patient first receives an intravenous injection of a medication called Photofrin, available from Axscan Scandifarm. The malignant tumor cells absorb and retain the photofrin medication more so than healthy cells. Approximately 48 hours after the injection, a small fiber optic thread about the size of a fishing line is inserted into either the esophagus or bronchial tube and placed in the area of the tumor. The drug is activated by applying a laser light through the end of the fiber optic thread,